Okay. Hello, my name is Dr. Dina. I'm a consultant family physician and a board director of Kuwait Family Medicine Board. Uh, in terms of Kuwait as a country, we were quick to shut down schools and university on the 1st of March. The government sector closed on the 12th of March. People received full pay and stayed at home. We have done that when cases were extremely minimal to keep everyone safe. We are currently on complete lockdown until the 13th of May.
I'm Dr. Sausan Al-Bannai, consultant family physician, head of Cordoba Clinic, and assistant director of Kuwait Family Medicine Board. The emergence of COVID-19 cases in Kuwait coincided with the celebrations of Kuwait's National and Liberation Day. So, on the first day back to work after the holidays, we had our plan ready. A triage system was implemented for the first time in primary care, an isolation room for suspected COVID-19 cases, and a respiratory clinic were established. Designated staff wore their PPE, all other staff wore face masks. The clinic previously established a WhatsApp number for patients' inquiries. This now became the clinic's hotline for medical consultations. Also, other clinics established virtual consultations. We offered home delivery for medications for those with chronic diseases as well as elderly patients with the help of local volunteers. With a determined team, we are ready to fight coronavirus.
Everyone, I would like to share my own experience with the COVID-19 virus. I was in contact with a colleague of mine who was infected with COVID-19, in which I had to take a nasal swab, which came with an equivocal result. I had to wait for 3 days to repeat the test again, which came eventually negative. Now, during these 3 days, I had a very stressful time just thinking about the people that I had met, and I didn't take the right precautions with them, especially my family, my colleagues. So, in order to avoid this feeling, my message to you from my experience is to take precautions even with your family, even with your colleagues. Treat everyone that they might be a source of an infection, as well as treating yourself that you might be causing a spread of the infection. So take a real care of yourself, take the precautions seriously, and stay safe. Thank you.
Bassam Al-Bathi, Senior Specialist Family Medicine and a trainer in Kuwaiti Board. I was always dreaming to help in field hospitals around the world, but I was not expecting to work or serve in field hospital in our country. We are serving in this area, which is totally quarantined with a population more than 400,000. And those people are low socioeconomic status and suffering from multiple psychosocial problems beside their medical problems. We are working here with our trainees beside our colleagues from different specialties as ER, GPs, counselors, social workers, and public health doctors. So beside our burden of being away from our families and working in high-risky area, we are heavily affected by our patients who are suffering from lots of problems, and we couldn't do so much for them. One thing I want to do after I finish, I want to hug my kids.
I'm Dr. Aisha Al-Kendari, a specialist in family medicine. As for my fears during the COVID-19 crisis, what I fear the most is that I might become a carrier of the disease. Every time I return home after work, I fear that I might be the reason one of my daughters catches the illness, especially my youngest one who suffers from juvenile rheumatoid arthritis and on Humira injection. My only consolation is that I always wear the protective clothing and that the incidence of the disease in children is low and mostly mild.
Good morning. My name is Sarah. I'm a senior registrar family physician, and it's currently 5 a.m. and I'm working in one of the hotels that the Ministry of Health have changed into quarantine.
My personal experience started with the largest evacuation of Kuwaiti citizens from all over the world. Of course, coming here, I had many mixed feelings. I was a bit apprehensive because I will have contact with people who will be considered as COVID positive until proven otherwise. I need to be extra careful because, like many of us, I do not want to bring any illnesses home to my family. At the same time, I am a doctor, this is my time, and I need to respond to the call of my country. Here in the quarantine, we work mostly through phone consultations as we want to minimize contact. This is a new concept for us here in Kuwait, and it took a bit of adjustment. After a while, we got used to it, and it is actually something we hope to continue after the crisis. Another thing that I hope we'll be able to implement is appointment system, as this is being done now amid the lockdown. The crisis has taken a toll on our country, but it has showed us that anything can be done.
During the COVID-19 pandemic, the Kuwaiti government came up with a massive repatriation plan. During a 3-week period, more than 29,000 Kuwaiti citizens were brought back home from across the globe. To ensure this process went smoothly and safely, the Ministry of Health called up hundreds of healthcare practitioners, including us family physicians, to work at Kuwait Airport. With each plane arriving, we identified and isolated patients with respiratory symptoms, and those who were asymptomatic were given clear instructions about home quarantine. Family physicians also participated in collecting nasopharyngeal swabs from all travelers. The goal of our work was to ensure that the repatriation process would not cause a spike in the number of cases in Kuwait. We're happy to have participated in tackling the coronavirus outbreak in our country.
When all of this is over, I'd like to see my dad and give him a big hug. Remember to stay alert, not anxious.